Good morning. Thank you all for coming out on a snowy day, but let me just tell you, Elaine and I spent 17 years at Michigan, so this would have been a gorgeous spring day for us. So, but thank you anyway. And I should add that Dr. Collins, one of our distinguished guests, spent 8 years in Michigan as well. He left in '93, we got there in '94. So he came here today without even a coat. So, you know, that tells you. This is a very, very bright day for us, indeed, a very joyous day, and hence I put on my very bright blue and yellow tie, because this is a great honor for our institution today to have Dr. Francis Collins, the director of the National Institutes of Health, and Senator Coons. So let me first ask them to join me at the stage, and then I will introduce them formally. So let's welcome Dr. Collins and Senator Coons.
Good morning. How are you doing?
We have many people beyond you who are watching this event on live stream, and we're very glad they could join us as well. Today's discussion is titled Partnerships for Progress, Improving America's Health. And it's difficult to think of any topic and an issue more important of those that are facing our nation today, because health and wellness touches everything. It touches our lives, it touches our economy, it touches our politics, it touches everything, as I said. And here at the University of Delaware, we indeed spent significant resources on improving people's health in our nation's healthcare system. And this is impressive for an institution that doesn't even have a medical school yet. But I should say that we have tremendous partnerships with Nemours and Christiana Healthcare, and we treasure those. And the same is true of all the work that we do on our STAR campus, where we will shortly have 1 million square feet of space, much of it which is dedicated to translational interdisciplinary research involving our health sciences and beyond. All of you, we have our health science tower, we have our biopharmaceutical innovation building, the House of Nimble, and of course, many other discoveries to come. So, we are also very proud of the work we do with our fMRI facility in biomedical and brain imaging. We just had a tour, and I should add that this morning, both Dr. Collins and Senator Coons had the opportunity to interact with some brilliant doctoral students and postdoctoral fellows. They ask some amazing questions. They present the intellect of this university to the world. We've also toured their facilities, and they were quite amazing. We have benefited in these efforts from funding from NIH. We have received, for example, this past year, $30 million of research funding. We could use a little bit more, Dr. Collins, but we certainly did well. We got our fair share. And we're also grateful to Senator Coons for his constant advocacy to make sure that science is funded at the proper level. And I should say that at the moment that administrations, for example, from time to time decide to go and force budget cuts, Senator Coons and others led the way so that the NIH funding has been increased by 30% in this amount of time. So let me just mention a couple more things about our two distinguished panelists, and I'll join them and ask a few questions, and we're engaged in a fireside chat that we all enjoy very much. Dr. Francis Collins is the director of the National Institutes of Health. This is the largest funding agency of biomedical research in the world. He's known for his landmark discoveries and for his leadership of the Human Genome Project, which is quite amazing. Let's give a hand to Dr. Collins just for that. He's a member of the National Academy of Medicine, the National Academy of Science. He has received the Presidential Medal of Freedom, same one that Joe Biden got, only later. And he, of course, is truly amazing. But there is something, I know that if you go to Wikipedia, you learn all those things. But as the university president, I want to always share with you something I found doing some research in your background. So what I did find, and I did not tell you in the morning, is that you grew up in Staunton, Virginia, small town, and you're an avid guitarist. And as a matter of fact, you grew up about 10 homes from the grandmother of one of our faculty members, Dr. Mary Dozier. I don't know if that name tells you anything. And her brother, Mary's brother, was singing the choir, in the church, and you were joining him playing the guitar. And Mary's mother has a lot of clippings. We could share those with you, with all your playings. And I also learned that your guitar is very, very special. Has an inlaid mother of pearls double helix. It's pretty amazing. So I'm a researcher and scientist myself, so I do my facts straight. And I know that you enjoy so much science and religion. You've authored a great book, a bestseller in New York Times. We'll talk about it later. But now let me say a few words about Dr. Coons, who really needs no introduction. Dr. Coons is probably the smartest senator. Please don't quote me on that, but I mean, I think he is. He is somebody who studied chemistry at Amherst, and then he studied theology in the School of Divinity at Yale, and also studied law at Yale. I don't really know anybody else in the U.S. Senate who has studied ethics, law, and science at the same time. So he's quite amazing. He's been an amazing person. And great help to our country in our efforts to protect science. So with that, I'm going to join the panelists and ask the first question.
Good.
So the first question, Dr. Collins says, in your mind, and I know there's a lot of stuff in your mind, what's out there? What are your biggest priorities? Where is health and healthcare going in the next 10 years? Tell us like your top 3 challenges. We've already, solved
I only got 3.
Okay, you get to tell us only 3.
I'll try. First, let me say what a pleasure it is to be here at the University of Delaware. What a fun morning it has been, seeing some of the science that's going on here, talking to some of the students, hearing what they're interested in, hearing the questions they have to pose. This is clearly a very vibrant research community that I had not previously visited, and I'm really grateful for the invitation and the chance to be here with such a distinguished group of leaders from academia, people who came for this occasion from other connected efforts in other parts of academia or in industry. So this has been quite a morning, and sorry about the snow, but it didn't seem to slow things down very much. So top 3, well, it is really tough because I sit atop of this amazing organization, the National Institutes of Health, which has as its goal funding basically every kind of possible medical research advance you can think of, from very basic science that doesn't necessarily have an obvious connection to any disease, to clinical trials, trying to get the next solution to Alzheimer's or whatever the particular need is. And if I had to pick 3, it's very tough because on that amazing portfolio of opportunity, there's so many things going on. I think I would start with cancer, and particularly with the incredible advances that are happening right now in this field of cancer immunotherapy, where it is possible, when cancer is there and when it looks as if nothing is working, the chemotherapies have basically run out their course, that we can still figure out how to activate that patient's own immune system to go after those cancer cells, because they are foreign. They're making abnormal proteins. That's the nature of cancer. It's a disease of the genome, which means it's a disease of the proteome, which means the immune system ought to be able to see it. But cancer is very clever, and it hides itself away. And what we have been learning, and this is building on decades of work by people who thought they were kind of lonely and unappreciated, and now it's the hottest science that you can imagine in cancer research. But we need to figure out how to make that work all the time. Right now, I could tell you dozens and dozens of dramatic stories of people who had what appeared to be end-stage cancer and who are now back at work and not just got a good response, they're cured. But I could also tell you a lot of people where it didn't work. And we have to figure out how do we go from this clear proof of principle to something that works for pancreatic cancer and works for prostate and breast and ovarian, works for brain tumors, all of those places where we still have a tough time coming up with cures. But we are on that path, mark my words. So that's number one. Number two, I would say we got to think about vaccines, and we got to think about the next real threat worldwide in terms of a biological catastrophe. And that's not a bioterrorism act by human actors, it's bioterrorism by nature, and it's called influenza. If you all have noticed last year, 2018, thinking back 100 years to that epidemic that happened in 1918 that killed at least 50 million people, influenza. And we're overdue for the emergence of another really bad virus. And we are pushing forward with lots of help from support from the Congress. And again, I got to say, Senator Coons, as an appropriator, as somebody who does his homework, who understands all of the complexities of what medical research is about, has been a phenomenal supporter of everything I'm about to tell you. That influenza vaccine that you get every year, and I hope you do get your flu vaccine every year, is the best we can do in every year, but as you know, it's not perfect. And it certainly wouldn't protect you against some newly emerging strain that's coming out of somewhere and which now has very high ability to be transmitted and very high mortality, and for which we have very little immunity. What we need is a vaccine that works for all influenza strains. And previously that might have been kind of a pipe dream, but now the combination of really sophisticated immunology, really sophisticated structural biology, so you see what the shape of that influenza virus protein core looks like, and really good genomics, tells us that there are things about all influenza viruses that are the same. And if we could raise an antibody against that, it would be protective against all of those options. The universal flu vaccine, that would be number two. Number three, I have to say, because it's such a national public health crisis, it's opioids. And what can we do, bringing the best science to bear on this crisis that is killing tens of thousands of people every year, more than die in car wrecks from opioid overdoses. And of course, we got into this mess largely because of overprescribing of opioids. Most people who are addicted started with prescriptions. But now those 2 million people have rewired their brain as a result of this in a fashion that is not possible to just will yourself out of. We have to help people with medication. But our medication options are not nearly as broad as they should be or could be. So we have a big push to try to come up with even more effective ways to help people who are addicted. And then we have those 25 million people who have chronic pain every day, for whom opioids are a terrible solution, but there isn't much else out there that's really potent. So we are working flat out with industry partners to try to see, can we bring forward at an accelerated pace and get approved medications that are powerful for pain but are not addictive. And there's a pretty good promise of doing that in the space of 2, 3, 4, 5 years, but if we don't do it now, we won't have it then. So we're in that space in something called the llHall initiative, H-E-A-L, Help End Addiction Long Term. And the Congress, again, much credit to Senator Coons and his colleagues, gave us an additional $500 million a year to push this forward at a pace that we otherwise would not have been able to. That's my three, but I could go on to 4, 5, 6, and 29 if you want me to.
No, this is terrific, and I wanted to ask Senator Coons. You see the wonderful things that NIH has been doing for us, and we thank you for your support and being a guardian angel. Will we be able to add some more resources in the next several years? And I'm thinking about so many challenges that need to be addressed, and the return on investment, really, from the work that the NIH is doing. What are your views?
Well, one of our very real challenges, at least in the last 2 years, in the political environment around sustained funding for NIH has been the president's budget. President Trump has proposed significant cuts to NIH funding and to basic science research in his last 2 budgets. On a bipartisan basis, Republicans and Democrats in the House and Senate working together have rejected those cuts and in fact have significantly increased NIH funding. Thank you. Now, one of the joys and one of the challenges of representing 900,000 Delawareans is virtually every disease state, every disease that impacts or affects Delawareans has an advocacy group that wants to come and meet with me. and talk about everything from Alzheimer's I mean, literally, from pancreatic cancer to lung cancer, from Alzheimer's to Parkinson's disease. And the wonderful thing about these engaged advocacy groups is that they are pushing for more funding for their specific disease state. What I try to say to every group is, I hope you're advocating for more federal investment in science, in healthcare, and recognize we're going to have to pay for it all somehow. One of the areas I'm most excited about that Dr. Collins and I were talking about earlier is the application of precision medicine to prevention. On its current trajectory, just to pick one disease state, on its current trajectory, we will spend $1 trillion on Alzheimer's alone in 2050. Now, $1 trillion is the entire discretionary federal budget. So if we don't find some way to develop not just a sort of a late-stage intervention cure, or at least treatment, but some measure of prevention, we have no hope of effectively dealing with the rapidly advancing diseases that impact an aging society. So from diabetes to Alzheimer's, what Dr. Collins and the army of researchers around the country and at NIH, but who are funded directly or indirectly through NIH, are doing is prioritizing across an incredible array of challenges that face us and face the world, and hopefully developing out of it startup companies, spin-out manufacturing opportunities, treatments and cures that we can then apply not just here in the United States, but around the world. Delaware is blessed to be part of a very strong biopharmaceutical community in the greater Philadelphia area that has led to real benefits for our community, not just from devices and pharmaceuticals and biologics, but also from employment. And so one of the reasons I advocate persistently for more funding for NIH is the follow-on benefits it has here at the University of Delaware, Delaware State University, Del Tech, and then for our broader community in terms of AI Children's, Nemours, Christiana Care, but then the benefits it has for all of us. How do we sustain funding for research? We sustain a commitment to science. How do we sustain a commitment to science? Frankly, a broader and better understanding of what's possible and what happens if we don't invest in basic research and in applied medical research.
So, Senator Coons, you brought up a great point with talking about the biopharmaceuticals and the biopharmaceutical innovation. I want to ask Dr. Collins. We have a great effort here on biopharmaceutical manufacturing innovations in that, and we believe that can be very, very synergistic in healthcare and providing excellent care to patients. Have we gone to the point that there is sufficient interagency collaboration, Department of Commerce, NIH, others, to address some of these big challenges that you talked about at the beginning?
Well, I enjoyed learning more about NIMBLE this morning from Dr. Lee, and understanding the ways in which there are real potentials here to even further increase those interactions. I certainly heard that NIMBLE and NIH have some points of contact, particularly in the cancer area, but I think the potential right now is even greater, and I'm going to go away from this morning with some thoughts to share with my colleagues back at NIH, particularly in the National Center for Advancing Translational Sciences, which shares a lot of those goals. Let me just give one example that I was talking to Dr. Lee about. We are at a remarkable moment for advances in genetic therapy. I'll give you just an example. There's a disease called spinal muscular atrophy, which is one of the most heartbreaking conditions you'll ever see. It's a genetic disorder. These kids appear completely normal at birth, but then they seem a little floppy, and basically they have ALS except as an infant. So the cells in the spinal cord that are involved in controlling motor function are degenerating. And without intervention, and there has been none until now, these kids invariably die by about a year of age. It is absolutely heartbreaking. Now, it's a genetic disorder, and with the tools coming out of the Genome Project and a lot of hard work, we know exactly what the molecular problem is in SMA, and actually in about 6,500 other genetic disorders. But how do you do something about that? Well, investigator at Nationwide Children's Hospital in Columbus, Ohio, decided, let's just really see if we pulled out all the stops. Could we deliver a normal copy of the gene that's missing in those kids and actually get it to the spinal cord cells where it's needed using a viral vector? And the vector he used is something called AAV. I wouldn't have given one chance in 50 that that was actually going to work, because there's so many parts to what I just said that seem like they're going to be just not efficient enough to help. But painstakingly working through the steps initially with animal models to make sure that the delivery systems looked as if they were efficient enough. Then he began treating just 12 kids, and he tried to catch those kids at the earliest possible moment before you'd start to lose motor function. And of those 12 kids, many of whom, when they started, were already a few months old, and that was 3 years ago. They're all still alive. And I brought one of them to a Senate hearing back in August, who's already 3.5. And she did a little dance for them, twirled on the floor, and you would have had a hard time perceiving this was not a normal 3.5-year-old. It worked. And that virus somehow had the appropriate tropism, I guess you'd call it, to get into those cells, to provide the gene that was missing. This was a single infusion, one time. Not something you have to take every day, one time. And as far as we can tell, it seems to be durable. Well, that got everybody pretty excited, but now all of a sudden we can say, wow, there are thousands of other possible diseases where this same approach could work. But coming back to Nimble, how are we going to develop the capacity to actually produce those treatments, which are viral preparations that have to be extremely quality controlled in what you'd call GMP facility? The whole world has a very limited capacity for that kind of production, and we are all going to have to work really quickly to come up with ways to do this. And it's the sort of thing that Nimble is designed to think through quickly. How do we expand capacity in an affordable way when there's suddenly a new wonderful medical opportunity?
And you'd be very pleased to know that we're working with our governor, to partner with our governor, to put together a proposal to NSF so that we could have a GMP facility right next to our biopharmaceutical innovation building.
That would
just
be great.
imagine what will this do to jobs and everything in Delaware. And
Make it really big. We're going to need it.
as big as the money allows. As big.
You know, to go back to what Dr. Collins said about the risk to our world of an influenza pandemic, we've got solutions. We've got promising new developments across cancer immunotherapy, across this gene therapy you're talking for SMA, and we talked earlier about sickle cell, and across vaccine development, where we've got stuff that's been proven in the lab and then in early stage human trials, but to scale it up and then deliver it is going to be very demanding. And we're excited that Nimble, here headquartered at the University of Delaware, is going to be at the center of delivering those solutions.
And talking about delivering solutions and translational healthcare, I want to thank you so much for your support of the IDEA program. You know, a few years ago, IDEA started as an institutional development award for especially states where they did not have academic institutions with the School of Medicine. And the state of Delaware and the University of Delaware has done well. We have, in the amount that the grants are out there, you know, with activities like the CTR, Axel, and IMBRI, and all that, and all of our partners, we've gotten, I think, $275 million of NIH research over a little time, and we've leveraged another $500 million from our partners, hospitals, others, you know, in the state. So it has, and beyond. That has been pretty amazing, but it's only 1% of the NIH budget. So just imagine what we would do if we had 2%. 2%. We'll get our fair share. And I know, Dr. Collins, you shared with us the morning of our breakfast that you were a skeptic when you first started the NIH, because you're a big science advocate, but we hope that we've convinced you that we do good work.
I very much have become a strong supporter of the IDEA program by going around and seeing how it has, in fact, catalyzed some remarkable science. And today is a great example of that. Having these centers, the COBRIs and the INBRIs, that within a particular state that maybe doesn't have Stanford or Harvard within their boundaries, but has a lot of talent, a lot of creativity. And hearing today how that has stimulated research to happen that otherwise wouldn't have, how people are now getting their independent R01 grants from NIH NIH built off of that capacity using the core facilities. I saw some amazing things like your brain imaging facility, for instance, which are going to be a wonderful catalyst for things to happen and probably would be very difficult without this kind of core support to make happen. So I've become a big fan of the IDEA program. It's up to the Congress to decide what to do with the 1%. Yeah. So I'll leave that right
and
where
kudos to all our fMRI scientists and everybody in brain and psychological imaging. We have some amazing world-class researchers.
Indeed.
I want to turn to a different topic in your portfolio, which is what is the right balance in your eyes between prevention and treatment of diseases? And how close are we to understanding the socioeconomic determinants of health?
It's a great question. I think traditionally medical research has been disease research. We call ourselves the National Institutes of Health, but sometimes it looks like the National Institutes of Disease, or at least it has in the past, because most of the research is done to try to identify in people who got sick, what can we do to help them? And that's really important, but we have underinvested in the past, I think, in the kind of research that it would take to understand how to keep people healthy. It's just not the model that medical research had over the decades. We are trying to change all of that, and I have an Office of Disease Prevention at NIH led by David Murray, who's regularly reminding me of all the things that we now could do that we had not done so well in the past. I'll tell you about one project, because I'm going to do a little marketing here for everybody in the room and hoping I can engage you in this one. This is your chance to become part of a major national adventure in understanding prevention. We really would like to know, in an individual basis, what you should be doing in order to stay healthy. If you go and look at the recommendations or go and talk to your doc, they will give you this list of things you should do and things you should not do. But it's kind of a one-size-fits-all list, isn't it? It doesn't necessarily seem like that's about you. It doesn't factor into that some of your own lifestyle, some of your family history, all the things that might mean you ought to focus a little more on this one and don't worry about that one. We want to move this one-size-fits-all approach in prevention into something I'd call precision medicine, where it's about the individual. But how do we do that? You can't just make the stuff up. You've got to have data. So what's the data you need? Well, you need an incredible database of information on a very large number of diverse people in order to find out what really does work and what doesn't work as far as keeping people healthy. And that's this study called All of Us. If you don't know about it and you want to learn more, and maybe you even want to sign up, just go to joinallofus.org. Join All of Us is just one word, .org, and you can read more about it. But here's the idea. We're asking 1 million Americans to come and join us as partners to provide information about their own healthcare practices, to give us access to their medical records, to provide blood samples that we can measure all kinds of things about them, including complete DNA sequences on them. And we will also ask them to walk around with wearable sensors that keep track of their health behaviors and what's happening to them. Now you might say, who would want to do that? This is the government asking you to share all that information? Well, so far 188,000 people have signed up as of last May, and we're on our way to 1 million in the next couple of years. All of the data gets anonymized, but then it is made available to any researcher who has a good idea about how to make sense out of it. This is really citizen science in the biggest possible way. And you also, if you're part of this, get all that information back on yourself that you can stand. Whatever you want to know, you're going to get it. You want your complete genome sequence? Here you go. We may not understand it yet, but it's yours. It's your data, after all. So this is a new exploratory adventure. I'm happy to say that in the first, what it is now, 10 months of this, we have managed, as part of our goal, to achieve 50% of the participants come from traditionally underrepresented racial and ethnic groups. So this is all about health care and health disparities. And also all across the country, different socioeconomic states, different kinds of geography, different kinds of environment. We're going to start enrolling kids later this year. The first year we were just going to do adults, but now kids are coming on board. This is going to be transformative. And for your question about how do you do prevention, this is going to be a foundation of information that anybody interested in prevention is going to want to look at. The other thing about this is these 1 million people are all signing up saying, I want to be part of research. If you learn something about me that you think I would be a good participant in a follow-up study, say about exercise or about diet, let me know, because I'd be interested in signing on to that too. So this will be a way in which a lot of future clinical trials can get started very quickly by a highly motivated group of people.
So this
Join
really...
allofus.org.
Absolutely, and this is an amazing effort, and obviously data sharing, the explosion of big data is really going to help us, collaboration to advance the cures and the treatments. But at the same time, there are important intellectual property issues. So I want to turn to Senator Coons, who is the ranking member of the Judiciary Committee, looking into patents and trademarks, intellectual property, and tell us what to do here.
Well, as many of you know, Delaware has a long tradition of research and invention and innovation in material science, as well as in pharmaceuticals and biologics, and in the biospace. And those are areas of initiative in our country that have critically relied upon intellectual property protection, mostly patents, but also trade secrets, to protect small startups and then eventually much larger companies, but to attract investment. In the Senate and the Congress over the last 4 or 5 years, we have had a huge fight that has avoided broad public attention between one frame of mind about patents that is mostly driven by the Silicon Valley IT software community that sees them as really unnecessary or problematic and has tried very aggressively to weaken patents, both with post-grant review procedures and by weakening patent defense litigation. And folks who come from communities that invent things like, oh, I don't know, Kevlar or Jacophy, recognize that for their inventions and innovations to be protected as they go through very costly scale-up, they need a very strong patent system. So we've had a really big fight in the House and the Senate over this over the last couple of years. Fortunately, it's moving back in the direction of strong patent protection. The current Patent and Trademark Office director is seeing some of the ways in which legislation passed almost a decade ago has been misapplied and overreached, and there is movement that I think is important. There's also a bill that's become law and some other initiatives that I've worked on with Republicans and Democrats that affects how early stage commercialization is possible out of NIH research, out of NSF research, and out of other federally funded research. Because we don't want to have huge amounts of investment in great cutting-edge work that happens in laboratories, and it never gets scaled up or commercialized. So we have to have a strong IP protection system so that we can have investment and scale up in inventions and innovations. We have to be more active, and the current administration, I think, is doing a good job at this, at pushing back against IP theft by some of our global competitors. But we also, frankly, have to have an immigration system that welcomes and recognizes and respects the best and the brightest from around the world, and allows them to not just come to America's world-class universities and invent things and then become citizens here and contribute to our society. Thank you. And we have to recognize the ways in which sustained federal funding in basic research as well as applied research is critical to persuading the next generation of world-class researchers that this is a career that you can stay in, that you can succeed in. And we've got a younger generation of researchers who imagine themselves not just as sort of pure academicians, but who have come of age in a time when the opportunity to both be a great researcher and a startup business owner is often a part of their worldview. So if we have a stronger IP system and continue to have the world's most nimble and robust venture capital system, and we fix our broken immigration system and stop making it difficult for people from around the world to stay here and contribute, if we do all three of those, we will continue to have the world's leading, most competitive, most innovative, science-based solution system.
So from IP, I want to turn to ethics. Yes. Both of you are known for your work in the field and being leaders for that. So last year there was this announcement about gene editing and genetically modified babies in China. And of course, it's great discoveries, CRISPR, at Berkeley and all other great things. what is the future of regulation in this field? And we can start with Dr. Collins and then Senator Coons. We'd love to hear from you as well.
So it is a very hot topic right now, and I'll express a view that's my own, but I think I speak for a lot of the NIH leadership. CRISPR-Cas, which is this system to allow very sophisticated gene editing, think of it as find and replace of the genome, as you might do on your word processor, has come on the scene with incredible speed and incredible excitement. I don't know any molecular biology labs to speak of that haven't at least started to explore using gene editing. My lab is using it right now to create all kinds of interesting experiments in cell cultures in growing in Petri dishes. But of course, this works in basically any cell. It is going to be the way in which we come up with treatments for incurable diseases like sickle cell disease. There is already an actively enrolling clinical trial to see whether it's possible using CRISPR-Cas to take bone marrow cells out in somebody with sickle cell disease, fix the sickle cell mutation, expand those corrected stem cells, and give them back to that person. They're their own cells. There's no need then to worry about rejection. It's an auto transplant, but you have gone right to the fundamental problem and you've figured out what to do about it. And I think that trial's going to work. And is that not an amazing thing to be able to say, sickle cell being the first molecular disease finally might be one of the first to get a molecular cure using this system? I don't see in that circumstance any brand new ethical dilemmas. It's about the question of, is this benefit worth the risk? And do we understand what the risks are? Have we carried out appropriate experiments to document that? And have we offered this to people with appropriate informed consent and with oversight by an institutional review board that has balanced out whether the benefits and the risks are appropriate? All of those things we know how to do. Where it gets very ethically dicey is the experiment that was done in China by Dr. He and announced back in November, which was that he edited human embryos and then reimplanted them with the intention of producing babies at birth, and succeeded in 2 twin girls who have had their DNA modified by human intervention for the first time ever on the history of this planet in a way that was utterly unethical, did not go through the appropriate steps of oversight, where the consent was fatally flawed, where the participants were given misleading information, and where the safety issues were only rudimentary in terms of their approach. So everybody who looks at this pretty horrified, but it happened. Could it have happened in the United States by some rogue scientist? Well, I can't say it couldn't have happened, but it would have had a lot of consequences. That would have been criminal in the United States based on the way that Congress has currently laid out NIH's limitations and FDA's limitations. No matter where your funding was coming from, if you did that experiment now in the US, it would be considered a criminal act. But we're all over the place in terms of the rest of the world's view. The ethical issue here is somewhat about safety. Do you want to do something like this without being sure you're doing the right thing and not causing harm? So-called off-target effects. Maybe your editor kind of missed the target and changed the genome in some other way, and you're creating babies who are going to have future children of their own, and nobody gave consent for that. That's part of it. But I think fundamentally, it's much more serious than that. Because we are, after all, human beings who over the course of these many hundreds of millions of years have evolved in a certain way. The idea that we think we're smart enough to be able to go in and change our very essence, our instruction book, it strikes me as a form of hubris that would be so far beyond what I think wisely we should be undertaking. And for me as a person of faith, it also comes into this space where one really has to question, are we ready to step into the role of being a creator instead of created? This has profound theological consequences as well. So some of us, me included, are currently promoting the idea that we should have a strict worldwide moratorium against further experiments of this sort for at least 5 years. We have to have the chance to have a broad social discussion about this, because right now it's mostly just happened in scientific discussion rooms, and decide, is this a line we ever want to cross again? Okay, this got crossed one time. Is this the beginning of something called a slippery slope, or is it like, okay, we don't want to do that, let's not go forward in this way. I can't come up with very compelling medical reasons why we need to do this, and I could go into more detail about that, by the way. It's pretty hard to identify those. So let's just slow this train down and say, and for the time being, we're not going to do this.
Senator Coons?
It's important for folks to have clarity about the distinction in the arc of what Dr. Collins just laid out. CRISPR has enormous potential to address genetic diseases, and some of the worst, most tragic diseases are caused by genetic flaws and can be addressed through gene editing. The idea that sickle cell, which is brutally painful and affects hundreds of thousands of Americans, but millions of people in Africa and in India, could be cured is very attractive, very promising. The specific case in China we're talking about is gene editing of human embryos, the consequences of which we really don't have any grasp of yet. And then the broader point that he was making is that all medical experimentation has to operate within certain medical frameworks around informed consent and understanding of the consequences. All of us should be attentive to the ethical consequences of animal testing, of the ways in which science is applied in our world, of the ways in which big data is impacting our privacy, our sense of self, and our ability to continue to be robust individuals with independent ideas in the context of a democratic society. In other places on the planet, we have governments that are using intrusive artificial intelligence matched with facial recognition, matched with DNA testing, to suppress ethnic and religious minorities in an unprecedented way. There are a lot of ethical issues in terms of how we apply some of these cutting-edge technologies. We are at the dawn of a new age in medicine and science. We should not be crossing the boundary into using some of these technologies on creating custom humans without really reflecting on what the consequences are. This is one of those turning points in human history where what was previously science fiction has become science fact, and now needs to be wrestled with by a broader range of folks who are not professional scientists, but who will have to live with the consequences if we casually fall into the practice of literally editing future humans as they are in utero.
Well said.
Well said, and I wanted to add to it a question to both of you. I'll start with you, Senator Coons, and then we'll come to you, Dr. Collins. How do your spiritual values affect the work that you do in the government, both of you?
Well, first, I try to approach the intersection of my religious faith and my public work on your behalf with humility. I do not have a sense of certainty that my faith's scripture, which is known as the Bible, has any specific political roadmap in it. There's others I serve with who seem to have greater confidence in this. I don't. And I'll simply say my faith tradition gives me an approach towards the world and all of us that views this as creation and all of us as created. It is in some ways in Western history the underpinning of the idea of the value of the individual. The idea that each of us is imbued with special characteristics, that each of us is worthy of respect. You can reach that conclusion through completely non-religious ethical means, and you can reach that conclusion through any of the great faiths of human history. I am interested in and concerned about how we respect each other, how we treat each other, how we are seen in the world, and what the consequences for future generations are of our impact. And all of that is informed by my personal faith. But I also, as someone who's elected by 900,000 people, who are elected to represent 900,000 people, try to remember that I represent a state with a very robust range of faith traditions, folks who are citizens and my constituents who have no faith, but are ethical, good people. We have one of the largest Hindu communities in America. I think we were the first state in America to have Hinduism be the second most widely practiced faith. We have a robust community within the Christian community and the Jewish community that ranges from, evangelicals and Mormons to Baptists to Lutherans to Catholics to, I could give you a very long list. I think the good news is that in a modern era, We continue to be one of the most both religiously and spiritually inclined advanced nation, but from our very founding as a country, we were about liberty, and we were particularly about the liberty to have a particular individualized faith or no faith at all. And everyone has to have the opportunity to express and experience that intersection between public decision-making and private beliefs without the state applying any pressure, putting a thumb on the scale, or saying this is a preferred way to be. A lot of our family's ancestors came to this country on a lot of different ships in a lot of different ways, but there was an important common strand of seeking liberty and seeking individual freedom and expression. A university should be one of those great places where we can encounter each other, debate with each other, and then reach our own conclusions. And I am concerned in the Congress, in our country, at our universities, that we continue to sustain that spirit of respect, the possibility of real dialogue, and a recognition of the critical role that a wide, diverse community of faiths have played in making this a truly great nation.
Dr. Collins, anything you want to add?
That was a simply wonderful statement by Senator Coons. I will tell you, I was not always a believer. I was an atheist in graduate school in chemistry and came to faith as a medical student when I realized my views about life and death were basically those of a schoolboy, and other people had thought a lot more deeply about this, and I began to read what they had written and realized that, as Chesterton said, atheism is the most daring of all dogmas, the assertion of a universal negative, something that scientists really shouldn't do unless they had absolutely compelling evidence, and I realized I didn't quite have that. So kicking and screaming over a couple of years of trying to understand why believers believe, and if so, what kind of faith they believe in. I, to my great surprise, became a Christian at age 27. And it was already at that point that I was deeply interested in genetics as well as medicine, and everybody said your head was going to explode because you're not going to be able to keep these two things within one brain. I have never had that problem. I see that science and faith are wonderful ways to investigate what is real, what is true, but they ask different questions. And as long as you're clear about what kind of question you're asking, and you decide whether, if it's about nature, well, maybe science is the way you better go. But if it's about a question like, why am I here? And is there a God? And why is there something instead of nothing? Science doesn't help you very much with those. But to be able to put them together, I have found enormously satisfying. I am one of 40% of working scientists who believe in a personal God. And that surprises people because we don't talk about it very much except in events like this, I guess. But I think it is entirely possible, if you're willing to set aside sort of very narrow interpretations of particular scriptural verses, to put science and faith in a very harmonious position. And I even started a foundation called BioLogos 10 years ago, which puts in place a meeting place for people who'd like to have that kind of discussion. I had to step away from the foundation in order to become a presidentially appointed director of NIH, but the foundation continues to flourish. In terms of how it influences my own decision-making, I think most people know that I'm a believer. There was some skepticism at first about whether that meant I was going to take particularly hard-edged views about ethical questions. I don't think that's been the case. I think I just enunciated to you a few minutes ago one of those rare moments where I have a different view about editing the human genome for the purpose of creating new kinds of designer people than maybe some of my colleagues. But most of the time, we're in the same place. The principles of ethics, benevolence, non-malevolence, respect for persons, justice, equity, those are shared by ethicists regardless of their religious tradition. I can look at them and say, well, I think I can see where they came from in the Judeo-Christian background, but they seem to be quite universal. One might wonder, in fact, why they're there as a pointer to God, but I won't go there. Anyway, I think I would lose credibility as a scientist, as a director of a funding agency that's supported by the taxpayers if I inserted my own sort of personal faith beliefs into big decisions, and I try not to do that. But I do sometimes feel like the believers out there need to be heard from as well, and that's maybe why in this circumstance where we're contemplating maybe the most significant scientific development in human history, re-engineering ourselves, that we really should stop and have that conversation and hear from all the voices of people who's going to be affected by this outcome, whether this is a line that we should cross or not.
Thank you. And while we're on the topic, one last question. We know you've written many books on science and religion. As a matter of fact, you shared with me that right after you finished the genome project, 2 years ahead of schedule, I might add, you went unemployed, so that you can wrap up a book that you were writing. And of course, we know how well that lasted when President Obama asked him to become the director of NIH. And incidentally, he's the only person, to my knowledge, who has survived 2 presidents and is continuing to serve. Let's give Dr. Collins a hand. But the question to you is about your best-selling book in New York Times, The Language of God. What is, in your view, the origin of life? Simple question.
You saved that for the last one. Oh my gosh. Simply put, I don't know, and I'm not sure we will ever really know what, if we had a time machine, maybe we could discover was happening when that first self-replicating system came into being. And I'm not sure, for me as a believer who has a connection to God as the creator, that it's a terribly important question to know the answer to. It's entirely possible that this is a product of natural processes put into the appropriate environment in the early days of the Earth. And there's some very interesting recent data about that, involving a possible collision with some very large objects that might have created the right kind of chemistry for RNA to come into being. If that's the case, that's fine with me. If on the other hand, we can't explain it that way and it requires something more supernatural, well, that would be amazing, but I'm hesitant as a scientist to insist that that has to be the answer. I think the real question is, how did this universe come into being, and what was there before the Big Bang, and how could you have something appear when there was nothing before? And that is a fundamental philosophical question that requires you, it seems, to come up with a creator who could not themselves be limited by space and time, otherwise you have not solved the problem. So on purely sort of arguments about physics, and I know somebody's going to talk about multiverses, but basically on a sort of straightforward Occam's razor kind of argument, it does seem that we're required to come up with something in the way of a creator. And then if you're willing to go there and say, well, what would be the nature of that creator? The fact that the laws of physics work, and that simple mathematical equations describe things like electromagnetism and gravity. They're simple, they're beautiful. So creator seems to have been a mathematician. And then you get into this whole thing about the fine-tuning of the universe and how all those constants that determine the behavior of matter and energy have to have exactly within 1 part in 10 to the 12th the value that they do, or the whole thing doesn't work anymore. And then you say, okay, mathematician, but also a heck of a good physicist. And apparently, if you're going to go that far with me, interested in having a universe where some complexity would happen, where some interesting things might happen, maybe even you and me. You can get there on a scientific basis as saying, this is plausible. You certainly can't get there and say, okay, I believe now, but it's a good way to kind of start down the path. I'm just reflecting on the path I traveled back in my 20s. The language of God goes through a lot of those kinds of steps, describing how it is that, in my view, science is not in conflict with faith. If anything, it's sort of a pointer to faith, but you've got to be really careful about, again, which kind of question you're asking and which way you're going to try to address it.
So you want to mention something? Yeah, please.
I just want to make a last comment, if I can.
Yeah, please.
To turn the sentence around about our faith in science. Because one of the things that concerns me, as someone who represents almost 1 million Delawareans, is ways in which our basic faith as a society in science as a discipline, as a way of studying and analyzing and measuring and then coming to peer-reviewed, agreed-upon conclusions. There's been some really striking recent examples. I happen to be a Democrat, some of you may know that. And in the Senate, until fairly recently, it was an almost universal divide between those who were willing to say that the scientific consensus that climate change is real, it's happening, and it's caused by humans, and we have to do something about it. That sort of seemed to break one party or the other, and I had a lot of my colleagues in my caucus who would sort of sneeringly say, well, the Republicans reject science. But there's also a pretty broad and growing movement that questions the validity and the efficacy of vaccines and vaccination, and that questions and challenges the efficacy and desirability of GMOs. And that tends to be mostly in my party. And the broader challenge, I think, for us is to recognize that there is a lack of faith in science that is growing in our society and in the world. There is an increasing doubt about whether or not scientists know what they're doing and know what they're talking about, and a willingness to reject based on internet postings that have no validity scientifically, that leads people to make important decisions about the care of their own children, about what to eat, about whether to vaccinate, and about whether to vote for folks who say climate change is actually one of the biggest things that has happened in the course of human history, and it threatens all of us. I'll just say that as someone who trained as a scientist and who has deep respect for the discipline of science, I hope that we will redouble our efforts to make it more broadly our purpose to engage younger Americans of all ages, because this isn't unique to a millennial generation, in our faith in science. Part of what I think is so engaging and impressive about Dr. Collins, and you just heard it in that conversation about creator and the nature, the physical and mathematical nature of the universe, is that science is an absolutely critical tool, not necessarily for answering philosophical or theological questions, but for examining, learning from, and then coming to some consensus about the world we inhabit, and then about what to do in it. And if we abandon our faith in science, the consequences for all of us and for our public policy are dramatic and are difficult and are, I think, tragic. And if we reinforce our investment in public education around STEM, and if we, frankly, invest in public education around civics, but that's another issue. It is difficult to have a functioning democracy that solves hard problems well when we have a democracy without engaged and capable and informed and educated citizens. And I'm showing my prejudice in favor of science and in favor, which I don't think is a prejudice, I think it's a recognition of fact, and a prejudice in favor of having a citizenry that sees and understands and grasps the consequences if we are unable to respect each other, debate with each other, and reach consensus conclusions. Both of these seem to me to be really at risk for the first time in my life. And I would urge all of you to be more active and be more engaged in advocacy on behalf of democracy and science.
So Senator Coons, we certainly appreciate all your advocacy efforts, the great work you're doing to bring more resources in science and STEM, to bring more diversity in these disciplines that we absolutely need. And we had a wonderful conversation with our students this morning, you can tell. And at the same time, to bring the social sciences, the ethics, all these values, our Biden School of Policy, all those great assets, I think, to our nation, to the debate. I know I could spend an all-day retreat with those two gentlemen, and many of you asked me many questions. I won't tell you that I read every one of them. I tried to bake in as many as I could in a synthetic manner, but we couldn't get to all of them. You know, one that I would have liked to ask is how close we are to reverse engineering the brain, you know, especially in an era of artificial intelligence and machine learning and all that great stuff. But we can bring Francis Collins back. I mean, he has been amazing. So let's give them a hand. And my thanks to all of you for coming, for your questions, for your participation, and certainly my thanks to Charlie Riordan, our Vice President for Research, and Andy Dickinson for their work. This was complex to organize, but we pulled it in a great way. Thank you all so much.
All right.
Thank you very much. I really enjoyed it.